Hi guys, my name is Jamil and you know that we were discussing about the steady state, and in this chapter we will discuss the effect of the rate of infusion on the steady state. I mean that rate of infusion, how rate of infusion affects on the steady state. The concept is this, that first you must know that what is the rate of infusion. Rate of infusion is the dosing rate. We can say that second thing is the dosing rate. Dosing rate. What does mean dosing rate? Mean that how much amount of drug we are taking per unit time. How much amount of drug we are taking in 1 minute. How much amount of drug we are taking in 1 hour. How much drug we are taking. How much amount of drug we are taking in 1 day. That is called the rate of infusion. Mean the dosing rate. Amount of drug per unit time is called the dosing rate, or called the rate of infusion, and it is shown by the K naught. Okay, so what is the rate of infusion? Rate of infusion is the amount of drug per unit time is called the rate of infusion. It is expressed by K naught. So now we will discuss that what is the effect of rate of infusion on the steady state. The first point is that the time to reach steady state is independent of the rate of infusion. So rate of infusion cannot affect the time to reach the steady state. Number one thing. Mean that how much we are taking amount of drug in per unit time, it doesn't depend upon this time to reach the steady state. It doesn't depend. Time to reach the steady state will be the same. It doesn't depend upon that how much we are taking the amount of drug per unit time, less amount we are taking or greater amount we are taking. It doesn't depend upon that. But time to reach the steady state will be the same. It will be same. It doesn't depend upon this. The second thing that, but the rate of infusion does determine the plasma level at steady state. Rate of infusion cannot affect the time to reach the steady state, but it affects the plasma level of drug at steady state. Remember that this rate of infusion does not affect the time to reach the steady state, but it affects the plasma level of drug at steady state. So if we increase the rate of infusion, then the plasma level at steady state will also increase. So mean that it is directly proportional. As you can see that if we double the rate of infusion, then double will be the plasma concentration of the drug, but at steady state. Remember this concept, steady state. So mean that if we increase the rate of infusion, then the plasma level of a drug at steady state will be increased. Double the rate of infusion, double will be the plasma concentration of a drug at steady state. At steady state, remember that one. I am not saying that the plasma concentration of a drug will increase. No, the plasma concentration of a drug at steady state will increase. Okay. So what is the concept? The concept is this, that rate of infusion doesn't affect the time to reach the steady state. Rather, it determines the plasma level at the steady state. If increase the rate of infusion, then plasma level will be increased. If decrease the rate of infusion, then the plasma level of a drug at steady state will decrease. So these are two concepts behind that. And he says that the similar relationship for other forms of drug administration. If in this case, let's suppose that we are taking the drug through injection, and will be the same rule for other administration. Mean that now, for example, we are taking the drug through orally. So when we are taking the drug through orally, then rate of infusion does not determine the time to reach the steady state. Rather, it determines the plasma level. Means that if we increase the rate of infusion through orally, then the plasma level at steady state of a drug will also increase. Same like that, double the oral dose, double with the plasma level concentration. So it is behind that. It says that. The second thing says that plotting dose against plasma level concentration at steady state gives this straight line. You can see that these are directly proportional. When two things are directly proportional, then we get a straight line in a graph. So it's the same like that. Dose means that if we are increasing the dose, then plasma level of a drug at a steady state will also increase. So we will get the straight line. If we decrease the dose, then it will also be decreased. So then again we will get the steady state straight line. So it says that if we put a graph plotting dose against plasma concentration at steady state, then we'll get this straight line. Simple that. And next concept is that plasma concentration is directly proportional to dose. We have just explained that plasma concentration at steady state is directly proportional to dose. If we increase the dose, then this will be increased, but inversely proportional to clearance. If we are increasing the dose, then the plasma concentration will increase, means that less amount of the plasma will be cleared by drug. So clearance will decrease. What is concept? The concept says that if we increase the rate of infusion, then it will increase the plasma concentration at steady state. When plasma concentration at steady state will increase, means that less amount of the plasma, less volume of the plasma will be cleared from drug. So clearance will be less, but plasma concentration at steady state will increase by increasing the rate of infusion. So now we will discuss the graph. You see here graph that we have taken the concentration on the y-axis and time on x-axis. So we will apply these concepts on this graph. Okay. So we have taken the concentration at y-axis and time at x-axis. So here is a five different rate of infusion. We give the 5 different rate of infusion to a patient. Number one thing. And then we get the 5 different steady states. Number one thing that we get the 5 different rate of infusion, then we get the 5 different steady states. But same time. Same time to reach the steady state. What is that? You can say here that we are changing the rate of infusion. First thing, 5 different rate of infusion. The second thing that time to reach steady state is independent, means that time will be same. It doesn't depend upon the rate of infusion. The third thing is that 5 different steady states. 5 distinct steady states of plasma concentration. Means the rate of infusion determines the plasma level. So these steady states will be different. So please look at here. 5 different rate of infusion. 1, 2, 3, 4, 5. One is the 5 mg per minute. Rate of infusion is the amount of drug per unit time. So 1 mg per minute, one rate of infusion. Second rate of infusion is the 2 mg per minute. Third one is the 3 mg per minute, 4 mg per minute, 5 mg per minute. So 5 different rate of infusions. The second thing is that the 5 different plasma concentration. You can see here. Here is the plasma concentration less, and here is the plasma concentration greater. Here is the greater. Here is the greater. Here is the greater. But before this, you see that same time. So here we are giving how much rate of infusion? We are giving 1 mg per minute. Mean that less rate of infusion. Time to reach is this. So time to reach the steady state. This is the steady state. So time to reach the steady state is this. Now we are increasing the rate of infusion. We increase the rate of infusion 2 mg per minute. First it was 1 mg. But the time to reach the steady state is same. Again we increase furthermore 3 mg per minute. Then again the time to reach the steady state is same. So it does mean that rate of infusion does not determine the time to reach the steady state. Time to reach the steady state is same. It doesn't depend upon the rate of infusion. But this determines the plasma level concentration. What does it mean, plasma level concentration? You can see here. If the rate of infusion is 1 mg per minute, then what is the plasma concentration at steady state? This is a steady state. This is a steady state. So what is the plasma concentration? What is the plasma concentration of a drug at steady state is this. Let's suppose that this is a 2. Okay. Then after this is the 1, because this is the 1 mg per minute. So this is the 1. Then we increase the rate of infusion 2 mg per minute. When we increase the rate of infusion 2 mg per minute, then what is the plasma concentration? Now steady state is here. So what is the plasma concentration? 2. So plasma concentration of a drug at steady state is 2. Same here. 3, 4, 5. So mean that as we are increasing the rate of infusion 1 mg per minute, 2 mg per minute, the plasma concentration of a drug also increases at steady state, also increases. So increasing the rate of infusion, increasing the plasma concentration, but time to reach the steady state is same. So this rate of infusion says about that the time to reach to steady state is independent of the rate of infusion, but the plasma level concentration of a drug at steady state depends upon the rate of infusion. By increasing the rate of infusion, with the plasma concentration of a drug at steady state will increase. Mean that both are directly proportional but inversely proportional to clearance. When plasma concentration at steady state will be greater, mean that low volume of the blood is being cleared, therefore clearance will be inversely proportional to it. So it was about the effective rate of infusion on the steady state. So now in this slide we will discuss in previous slide we discussed the effect of the rate of infusion on the steady state. So now we will discuss about the effect of loading dose on the steady state. So we will discuss about this concept. So normally it takes 4 to 5 half-lives to achieve the steady state. We discussed in the previous lecture that it takes 4 to 5 half-lives to reach the steady state. One half-life, second half-life, third, fourth. Clinically, if we see the clinically, then it takes 4 to 5 half-lives to achieve the steady state. But mathematically, greater than 7. We have discussed in the previous lecture, that was about steady state. But clinically, it takes 4 to 5 half-lives to reach the steady state. Let's suppose that the first half-life, second half-life, third and fourth half-life. And after fourth half-life, you can see that now it is in steady state. You can see that. So normally it takes 4 to 5 half-lives to achieve the steady state. But you know that sometimes patient is in emergency. When the patient is in emergency, then we can't wait a long time. We have to give the patient effective drug in less than no time. So we can't wait. The patient is in emergency. Then we will use the loading dose. We will use the higher dose of the drug. We will give the more dose of the drug. And this loading dose will help us to achieve the effective blood levels, to achieve the steady state concentration very rapidly. So what is the concept? The concept is that sometimes the patient is in emergency and we can't wait long. Then we will give the loading dose, and this loading dose will help us to achieve the drug plasma level at steady state very rapidly. So it is about that. And how we can get this plasma level, how we can get rapidly this plasma level, how we can use this loading dose. We will take the one bolus at one time. We will take the one bolus, you can say this is the about the loading dose. We will take the one bolus at one time, but this bolus amount, this amount of drug, this dose of drug must be equal to steady state. This is the steady state. So this bolus we are giving in one time, that must be equal to the steady state. So mostly time it is one bolus at one time. At one time we will give the one bolus, but this one bolus will be equal to the concentration of drug and plasma at steady state. So it must be equal to the plasma level of a drug at a steady state. And the second concept is that for the exams there comes a question. The question is that if doses are to be administered at each half-life of a drug, mean that the dosing interval equal to the half-life. What is the dosing interval? Mean that the interval between one dose to another dose, the time between these doses must be equal to the half-life. And the second is that minimum effective concentration is equal to the plasma level concentration at minimum. You can see that minimum effective concentration must be equal to this one. So drug concentration must be so much that it can show its effects. Mean that it must be greater than the minimum effective concentration or equal to the minimum effective concentration. Then after that, then the loading dose will be twice of the dose used for maintenance. So we were using some dose. We were using dose that we are taking 5 mg per minute. 5 mg per 4 hours. So after 4 hours again for 5 mg, again 4 hours 5 mg. Then we are using this one for the maintenance, and then we get the steady state after 4 to 5 half-lives. But if we want to use the loading dose, then we will, if we are taking 5 mg per for 4 hours, then we will use the twice. If it is 5, then we will use the 10 mg in mostly cases. So 10 mg hour will be the loading dose in case of emergency. Concept is that if doses are to be administered at each half-life, that each half-life is equal to dosing interval, and second is the minimum effective concentration is equal to the plasma level minimum concentration at steady state. Then the loading dose will be the twice of the maintenance dose. For maintenance dose we were using the 5 mg per 4 hours, but now we will use the twice, that is 10 mg for loading dose. Then we will get that concept. The second concept is about its formula. The formula says that the loading dose is equal to volume of distribution multiplied by plasma concentration divided by the F. The F is bioavailability. So what is the volume of distribution? You know that volume of distribution is equal to dose of a drug divided by the C naught. What is C naught? C naught is the concentration of a drug in a plasma at 0 time. At 0 time, what is the concentration of a drug in plasma? That is called the C naught. And D is the dose of a drug and VD is the volume of distribution. So volume of distribution, I am trying to remember you the previous concepts, that volume of distribution determines that where's the drug in our body at this time. So let's suppose that we say that the this C naught is greater. C naught is greater. If we say that C naught is greater, then mean that the plasma concentration of the drug is greater. So VD will be low. When VD will be low, mean that the plasma concentration is greater. Mean that the drug is where? The drug is in our plasma. So we can say that drug is in our plasma. But if volume of distribution is high, then it is inversely proportional to C naught. Then C naught will be low. C naught is low, mean that there is a low amount of drug in the plasma and high amount of drug in our tissues, in our muscles, in the target tissues. So drug will be in our tissues. So it is literally about volume of distribution. And second is the multiply by the CP, mean the target plasma concentration. That is what? That is steady state. Mean that what is the plasma concentration at the steady state? That is our target plasma concentration we have to give to the patient. Divided by the F. F, you know, that is bioavailability, mean that how much drug is available in tissues. How much drug is available in blood for action. That is called bioavailability. That was about previous concept. So loading dose will be equal to the volume of distribution multiplied by the target plasma concentration divided by the bioavailability. The next is that potentially dangerous, so careful. As you see that in loading dose, we use the higher amount of the drug, higher dose of the drug, so it can be effective. I mean that, as you see that if you take the overdose of a drug, then it causes toxicity. Toxicity can affect our health. So we must be very careful, because in this case we are taking more dose. When we are taking more dose, then it can be toxic. So therefore we must be very careful, and we must use the loading dose just in case of emergency. Otherwise we should use the maintenance dose. If we have a emergency case, then we should use the loading dose. But otherwise we should use the maintenance dose, because it is very dangerous. It can cause toxic effects. So we should be very, very careful. So now we will discuss about the graph. In the graph, I will take the example of the drug digoxin. Digoxin, that is used for the arrhythmia, I mean that it controls the heartbeat of our heart. Arrhythmia, digoxin, used for the arrhythmia disorder. And digoxin half-life is 2 days. Its half-life is 2 days. So time to reach the steady state is how much half-life? Clinically 4 to 5 half-life. So we will multiply 4 to 5. It may be 8 to 10 hours, 8 to 10 days. So we are taking digoxin in arrhythmia, in case of arrhythmia. Then half-life is 2 days. Then after 8 to 10 days, it will get its steady state plasma concentration, digoxin. Same like that we will give the amount. Let's suppose that we give the, some amount. Then we will get after 4 to 5 half-life, we will get this plasma level concentration at steady state plasma level concentration. We will get the steady state after 8 to 10 days. But no, if we have a life-threatening arrhythmia, then what we will do? We have a life-threatening arrhythmia and the patient is in emergency. Then we will use the loading dose. So what is the loading dose? Loading dose is that we will use the 1 bolus at one time, but equal to the concentration of drug at plasma steady level. So look at this. This is given at the one time. And this is the 1 bolus also at one time and 1 bolus, but its concentration you can see that equal to the steady state. So this is the steady states we get in 8 to 10 days of digoxin. So this is the steady state, and we will take the concentration of digoxin. We will take the concentration of digoxin in case of bolus, which will be equal to the concentration of digoxin in plasma at a steady state. So it must be equal, but 1 bolus at one time we will give, and then we will we will be able to control the life-threatening arrhythmia. So it was a little bit concept behind that. The concept is this, that if we take the steady state, then it takes a lot of time, but we have a life-threatening arrhythmia, then we will use the loading dose, and loading dose in case of loading dose, we will be able to control the arrhythmia. And the next concept is this, that if we taking this loading dose, then after getting one bolus, you know that as we increase the plasma concentration, then elimination will increase, then it will come towards here. It must come here. To solve this problem, then we will follow the maintenance. Mean that if we were giving after 4 hours, we were giving 5 mg. Then now this maintenance, and in case of loading dose, we will give the 10 mg. Same like that, I have explained here that we will take the 10 mg twice the size. So we will take the 10 mg after another 4 hours. So when we give the 10 mg, then it will comes down. Then again we will give the 10 mg after 4 hours. Then it will become again. So it will remain in steady state. So it will remain in steady states, and we will be able to control the disease. So this was some effect of loading dose on the steady state. So thank you so much, guys.